and we're moving into our second conversation for today as we find out more about the HPV vaccine rollout. We have with us, representing the Ministry of Health, Eufemia Waight, who is the Expanded Program on Immunization Coordinator, and Dr. Largaespada, who is the Maternal Child Health Coordinator. Good morning and welcome.
Good morning. Thank you very much.
Good morning and welcome. It's always nice to have you on. We know that this is very essential when it comes to the HPV situation. We have heard about it and we know that there was a program on. Can you elaborate more about how that went?
Yes, the HPV vaccination is one of the preventive intervention at primary level for protecting the girls against HPV infections, and that can lead to cancer of the cervix. So it's a protective measure preventing cancer of the cervix in the future.
Yeah. Now, this was actually a great achievement by the Ministry of Health to be able to acquire the vaccination to offer to the public for free. However, because of the age range that was being targeted and because of some of the misconceptions that people had in terms of what it meant to deliver the vaccine, you had a very special education campaign to have people understand what HPV is and can do, and why the vaccination is important. Let's talk about some of the elements of that education campaign. First of all, if I remember one of the statistics, HPV is pretty much the most common sexually transmitted infection that people get.
Yeah. We lay out the educational component, reaching out the different sectors that would be directly involved with the administration of the vaccine, and those that come in contact with the parents that we would be talking to also. We did have some limitations with, and we still have limitations with the use of mass media, but we reach more than, I guess at this point now, we reach more than 1,000 stakeholders, where we provide them with the information. And what we learn from these sessions is that once we present them with the facts and the evidence that is there available, the acceptance is very high. Yeah. I think people clearly understand the objective of the HPV vaccine to protect the girls. The age group that is recommended by WHO is 9 to 13 for countries that are starting. We are 10 years after the vaccine was released, introducing it to Belize. Other countries, huge countries like Australia, the UK, I mean, they started at the beginning when the vaccine was released. Yeah. But the acceptance rate, we would say it's pretty high. Now, we had some difficulties in reaching everyone at the same time. So that is what showed the difference in the coverage.
So you went out to primary schools across the country, sought parental consent for young girls between 9 and 13 to be able to receive the HPV vaccine.
But we were targeting only one cohort. Okay. So we started out with 10 years, but when we reached to standard 4, then we noticed that there were more than 10 years there, 10, 11, 12. So not all 10 years was in standard 4. So we met with the Ministry of Education, who fully support this initiative. And we agreed that we would continue the vaccination of standard 4 blanket. Okay. Because we will
not an age range, just standard 4 students.
Yeah, because, and why standard 4? Because we look at the statistics, and by standard 6, 20% of the girls drop out from school. So the highest number of girls are in standard 4. So to be able to reach them at a lower cost, operational cost, we have them there in that captive audience. No? That's why we target standard 4. What we're recommending is that families that have a girl 10-year-old that is above standard 4, standard 5, or standard 6, they can go to the health center and get the vaccine. For the girls that are 10 years old below standard 4, we would recommend they wait until they reach standard 4 to receive the vaccine. So
Okay.
pretty much.
Now, Belize has always had a very good record with vaccinations. This one perhaps was a bit different because you had to go in and introduce it as a new vaccination. What was the overall response in the country? How successful were you in being able to get parents to consent to having their girls receive the vaccine?
Well, the experience so far is that once they receive the information and they are afforded the time to review the fact sheet that is attached to the consent form, we get a good turnout. The problem that we had was that some PTA's meeting were called, and out of 25 expected parents, only 2 show up.
Wow.
Or only 3 show up. So we had to so right now what we are doing is going back to the community. Last night we were at Hamalale radio station trying to convey the information to the parents because I mean they need to hear the information before making a decision.
What districts were particularly positive in their results?
The northern districts and one of the southern districts.
Okay.
So we have 3 districts that did very well, and then we have the other 3 that actually didn't do so well.
Yeah.
And those are the 3 districts that we are targeting to return to the schools and to provide the information necessary for parents and trying to engage them into the acceptance.
And these are the 3 more populated areas, which means they have higher incident rates for cancer in the first place. So definitely important to go back into these areas.
Yes.
Is there a reluctancy when it comes to, because it's alarming to know that while you look at 25 situation or cases there, not cases, but 25 parents would hear about it, but only 2 would eventually bring their child in. Is there a reluctancy with parents bringing their child for a vaccine because of HPV, or it's because they're not educated enough when it comes to dealing with the HPV virus, the HPV?
That is difficult to answer at this point because we would have to find out why they did not reach.
Yeah.
But
Because when
some of them said they were working and they can. Some of them said they already had a PTA meeting, so they were not coming out just for the vaccine.
And it's interesting because we hear teachers complain about this as well, that you call a PTA meeting and only few come out of who's supposed to come. Unfortunately, in this case, in all cases where a PTA meeting is called, it's important for the parent to be there. But in this case, there were it was a different issue where the child would have been able to access the vaccine. Now, let's talk about what some of the misconceptions are that are being spread around at this point in time. And I want to ask whether or not you feel that had any influence on some of the parents' decisions. In other parts of the world, they have been able to, I don't know if it's fully eradicate, but pretty much eliminate cervical cancer, which kills so many of our Belizean women, from their statistics. In Belize, having the rollout of the HPV vaccine can eventually lead us there. But there are persons who seem to have been misinformed, spreading information about what the vaccine could do, and it really is false information. I'm talking scientific facts here, whoever wants to dispute it. Do you feel that people were paying attention to these campaigns and maybe they influenced their decisions?
We were discussing precisely that topic last night, and if you look at the pyramid of knowledge, at the bottom, meaning the less evidence-based, is an opinion. And at the top, you have randomized controlled trials, systematic reviews, and those are the ones that we use. I mean, we can't go out there and convince parents of the importance of the vaccine with just our opinion. We have to show them the statistics, we have to show them the evidence that is there available. So what we are recommending to parents is look for the information. If you cannot find it, but make sure you look in a good source. Come to the meetings, hear what we have to say. We will give you a fact sheet. You can go over it at your own pace, and then you make your decision. But one of the hosts was saying, how can you deter women or girls to access the vaccine without giving them an alternative to prevent HPV infection or cancer of the cervix at a later on? So it's not just saying don't do that, but then what are you offering? So what we are offering is prevention and protection.
Yeah.
And we use the data based on the evidence available.
Yeah.
And so far, I can tell you, I mean, the acceptance rate is pretty
For those
high.
who get the facts.
For those who get the
Yes.
information and
Yeah.
the facts, yes.
Yeah.
But do you feel that the information is actually reaching, because this is very important? Cervical
Yes,
cancer, we
yes,
know.
and we know we haven't gone on to the use of the media for promoting the use of the vaccine, and that is an area that we would need to collaborate with you all and see if there is any room for donation of airing time. We have a video, and we haven't been able to pass it on the different media houses, no?
Yeah.
Because of the cost. So
Yeah.
Wow.
So what is
that would be a good contribution from you guys.
So what is the second wave of education going to look like at this point in time? So you attempted the PTA course, which is the one-to-one with parents. Now you're going back hoping to reach them again. How will you do it differently to ensure that those parents who weren't privy to the facts, that they can get them and eventually make a decision for their child?
Yes, we learn a lot of lessons. We reach the different stakeholders, and sometimes we skip an important group like principals and teachers from the schools that are being targeted. So we know that that is a must. And then, of course, making sure that we reach on time to the PTAs and not calling an extra PTA meeting to provide them with the information, because this vaccination program have to follow that same pattern. We have to educate the parents for them to decide if the data will accept the vaccine or not.
Yeah.
We don't want, it's not like sending the leaflet home and begging them to sign. Yeah, that is, it don't work like that.
Yeah.
It doesn't work like that.
Okay.
Now, Eufemia, let's talk about what the HPV vaccine does. Let's talk about how you have been able to talk with parents about the importance of having their child protected from HPV.
In terms of well, we have been asking parents to vaccinate, and the vaccine is safe for their child. The vaccine actually, we purchase, the Ministry of Health purchase the vaccines that are pre-qualified. We don't accept donations and per se, so it's not a free something, it is purchased by the government. And so we, when we vaccinate, we tell the parents about what to expect, what the vaccine would do, that you need 2 doses to be protected, because one will not do. Once you have not been exposed to the virus, then there's a high possibility, 100% actually, that you will not develop cancer of the cervix because of the 2 types of HPV antigens that are in the vaccine, so which would be 16 and 18, which were the more prevalent ones. And that we tell parents too that the little side effects, because a lot of there's a lot of talking about the side effects about the vaccine, but when we talk about side effects, anything that we put into our body has side effects. The diabetic medication that you get has side effects, and even the paracetamol, the Tylenol or acetaminophen that you get, those have side effects as well. And every medication comes, or injection comes with a list of side effects. You have the most common ones and the not so common ones that occur because of studies that they have done.
Yes.
So what we say, you will have a little fever, probably you will have pain and swelling or redness at the injection site, but what is that compared to developing cervical cancer that would on the long run actually be very painful at the end stage? And unfortunately, that is what you get. normally you don't know you have cancer until it is
late
Yeah.
well
stage, yeah.
advanced, and that's the problem with it. And so comparing what is a little pain or a little bad feeling after the injection to the cervical cancer, that you might lose your life, leave your children behind, and all of that.
So parents need to know that prevention is better than cure.
Exactly.
What you do, you probably have to ignore the fact that yes, there will be a side effect, but at the same time, it's best to prevent your child, yourself from getting cervical cancer. Now,
And
in
parents
terms
who
of
vaccinate babies know they have sore arm and little fever.
Exactly.
So I think,
It's- And those are the most common side effects that you would have from the vaccine.
yeah.
in terms of especially for those who are not able to get to a health center, probably come to the urban areas. What is being done in the rural areas besides the schools? Do we have readily available in the health centers in the rural areas?
Yes. The vaccine is distributed to all the health facilities in Belize, throughout Belize. And we also have the nurses going into those communities where there is not a health facility. The nurses go into that community every 6 weeks. 6 weeks to every 6 weeks to provide those services, not only immunization services, but deworming, vitamins, and all of that they provide in the rural communities for those who cannot reach out to a health facility. So all public health facilities throughout the country has the HPV vaccine.
So if I am a mother or parent in Belize City, and I didn't make it to the PTA meeting, maybe I had to work at the time, and I do have a child in Standard 4, a little girl in Standard 4, and she didn't receive the vaccine. What can I do? Do I take her to Cleopatra, Matron Roberts, KHMH, or do I contact the school and ask when the representatives will come back? What will be the way to access the vaccine? There is no cost to me as the parent, but I still have to make the connection to be able to get access to it.
Yeah. Well, we are recommending for them to visit the health center to get the vaccine.
Okay.
For the schools where we were a bit low, then the nurse will go back to the school and redo the provision of the vaccines.
What is the hope from the Ministry of Health perspective? Because it's a big investment. The vaccines are costly, and they were available before. They have been available in country, but they were very expensive to be able to access. Now that the Ministry of Health has purchased them, that's a hefty investment. What are you hoping will be the results of the rollout of this vaccine?
To date, we say we have a successful rollout, but we have to go the extra mile to reach those that we could not reach, and not just close off that opportunity because they couldn't come to the meeting. So we need to go back and offer it to them again and make sure we meet with them. It's more costly if we go home to home, so we are asking the parents to please put their part coming to the meeting so that we can share the information, and then from there they make their decision. But so far it's a success.
Now, to be very clear, you won't see changes in our rates of cervical cancer this year or next year.
What you see, what the studies are showing, for example, in the US, more than 50% in a matter of 3 years, a reduction in genital warts, because the vaccine includes 6 and 11, and that covers 90% of the genital warts. So that show a tremendous decrease in a short period of time. Same in Australia. And the younger the girl gets it, the best, because the protection is more effective.
So parents should know that it's not too late for them, for those who missed it the last time.
No, they can contact the health centers or wait for the nurse to come back. Just find out with the school if the nurse will come back, and then make sure that they get the opportunity to receive the tax before signing the consent, and then we administer the vaccine.
If we go to the health center, is there a cost to getting that vaccine?
No.
Okay.
No, it's the same.
Okay.
No direct payment. I mean, the government we were saying last night, they already prepared it because it's procured through government
Yeah.
funds.
Okay.
So, I really want us to talk about the connections just one last time between how this HPV vaccine will change the statistics that we're used to in terms of cervical cancer. Cervical cancer is one of the leading, if not the leading, cancer that affects women in Belize.
Yes.
And one of the leading cancers that cause death in Belize. How does the HPV, or how will the HPV vaccine change that reality of women in Belize?
Yeah. That is an excellent reflection that we need to do every time we have the opportunity. Now. The HPV, the virus, if we provide the vaccine to the girl 10-year-old or in standard 4, and later on when she start her sexual contacts, later in life, after 25 years, if they're hearing
Hopefully.
hopefully.
Well, our statistics say initiation is what, 15, 16?
Some studies say as low as 12. Anyway.
Yeah.
But when she come in contact with the virus, then the antibodies that develop because of the vaccine, that would confer protection. And it is demonstrated that is 100% protection against that type of HPV 16 and 18. And same for 6 and 11, that covers 90% of the genital warts. So yes, we won't see the decrease in the cancer of the cervix at a shorter period of time, but that is the level of protection that is the vaccine is offering. And we were, last night, we also mentioned that if we 3 girls were to compare with 10-year-old girls today that receive the vaccine, obviously they are protected against 16 and 18 that cause 70% of the cancer of the cervix. We don't have that protection.
Yeah. So in a couple years, I can be struggling with cervical cancer, or one
As
of you.
us, yes.
Because
That's
we've
the
never
big
had
difference, and that is what how do we translate this in words to the parents for them to understand? But that is the reality.
Here's another eye-opening statistic that I found. HPV is a virus. It's a sexually transmitted virus given to women by men, and actually passed on either way. And is it as much as 80% of women who are sexually active will come in contact with a HPV vaccine?
80% of the population at some time in life
Have come in
will
contact.
have contact or be infected with the HPV virus.
And then the HPV virus specific antigens, which means there are many different types of virus.
More than 150.
More than 150. But some of the more common ones in Belize are the ones that affect the cervix and can lead to cervical cancer.
The most common one are those on the skin. And the one for the cancer of the cervix, those are sexually transmitted. But it can also be transmitted just skin-to-skin contact. So you were saying everything have to be clean. So if anything is growing, in the genitalia area, you need to check it because it could be HPV.
So men are carriers.
Men
are carriers. Is there anything or any study out there to say that there could be something done to men to eventually get rid of it? Is there a possibility of such thing?
What the evidence is showing is that if we get 80% coverage in girls, there is no need to vaccinate boys. But if the vaccination coverage is low, then boys should get it also. But the vaccine is available for both.
It is passed between both, right? So that's why it keeps on spreading the way it does. And you keep on citing Australia. Australia had the lowest incident. I mean, they have like a couple hundred for their massive population cases per year. And we are struggling with our small population with such a high prevalence rate.
And a next point that we can share with the community is that if we go back and look at the statistics for polio in the last 22 years, last 22 years when we had more robust data, no? Polio was reduced 99.6% due to the vaccine. We have polio worldwide in only 4 countries. And in the rest of the countries, it
And
has
they're
been
actually at the point
eliminated.
where they feel that they can eradicate polio
Yes.
from the world.
Yes,
Yeah.
it's just those 4 countries that are still struggling to reach high coverage.
Yeah.
So that's the benefit of the vaccine. I mean,
Yeah. So, in essence, what you try to communicate to parents is that you can actually offer to your young child, a cancer prevention vaccine, a cervical cancer prevention
Yes.
vaccine,
Yes.
by allowing them to get the HPV vaccine.
yeah.
Well, we hope that you have success in that. Let's talk about the plan at this point forward. Will you continue to introduce to Standard 4 students on a yearly basis? Has the money been allotted already to purchase those vaccines?
It's included in our national vaccination budget.
Okay.
So it's within the national vaccination schedule.
Okay.
So
And
it's
for
a
how long
yearly
will you
effort.
continue?
Right. So
Until we start to see those phenomenally low?
Until
Yeah.
we can eliminate.
Yeah. Yeah.
Well, I guess we should be
Cancer
seeing you
officers.
guys and then again hearing you out there in terms of educating the folks, or parents actually, in terms of, you know what, you need to get your daughter or your child vaccinated, because this is very important for
Yeah.
the future.
yeah, outside of the standard for girls, and then any other person interested in other age group, and even boys, can access it through BFLA, and BMA also is coming on board
Okay.
But at a cost?
at a cost.
Yeah.
Okay.
Pretty low compared to the market.
Okay. All right. Well, ladies, thank you so much for coming in and sharing this information with us. We wish you the best of luck with the rest of your rollout.
Thank you very much.
Definitely.
And we accept donation of everyone.
We'll make it happen.
And you know what? I'm excited. Actually, the first 2 segments were wonderful segments. I'm actually excited as well for the 3rd segment that is coming up. Rastafarian in Belize.
That's right. That's coming up after the break. Stay tuned.